Hi guys, and welcome to part 2 of Treatment Tuesdays. This is Chester. He's going to help me show you what I'm doing as far as vitamins and supplements go as part of my Lyme treatment. Excuse me. First thing I do every morning after my water and my lemon water is I drink a mug of bone broth and I add collagen to it. And the reason for that is there are multiple reasons. One is gut health, which tends to be destroyed by Lyme and other infections that often come with Lyme. And the other is that Lyme destroys joints. It really loves attacking joints, so this kind of just helps me keep some of the joint damage at bay. Sometimes I will also have this protein powder at some point during the day. I'm working back into having this every day. It's got a lot of good stuff in it, and it's just fairly easy. So technically I do that in addition to or in place of a meal sometimes, and I'm working on getting back into that. Another thing that I'm working on getting back into is the green drink powder, because salads are just beyond me right now, and really I'm supposed to be on a diet of mostly salads. It's just too much standing and chopping and all that. So I've got my green powder, which I'm working on adding back into my daily routine. And when that one's gone, I'm going to be replacing it with this one, which I got to try, and I found for a fairly good price on Amazon. So I'll probably just alternate. I'll get this when it's on sale, and when it's not, I'll get something like this, which is cheaper but still good. Then I've got my multivitamin. This is the one I'm using right now. So far, I've been liking it. And the problem with Lyme is that it depletes pretty much all your nutrients. It just pretty much sucks everything out of you. So, I feel better when I take the multivitamin. And I started taking this hair vitamin. This is Maxi Hair. I started taking it years ago for hair growth because that's something I'm into. And I noticed, this was before I knew that anything official was wrong with me, but I noticed that this made a difference in my pain. So I've been taking it ever since. I do feel a difference when I take this every day, and part of that is that when you're under stress of any kind, when your body's under stress, you need a lot of B vitamins, so that's part of it. But I think it's also, there is horsetail extract in the ingredients, which is very good for hair, but it's also good for pain, and I didn't know that when I started taking it, but I've learned a thing or two since then. So I take that. And then one thing that most chronic illnesses do is they deplete your magnesium. They deplete all your minerals, but especially your magnesium. And that leads to higher pain and general everything in your body not working as well. So I've been taking magnesium glycinate. And I recently found out that there are different benefits to different forms of magnesium. This one is one of the most bioavailable. Your body has the easiest time absorbing magnesium glycinate. So I'm going to keep taking that, but I'm going to sub it out a couple times a day with different ones as well, different forms of magnesium. so that I'll just kind of cover my bases, get a little bit of everything. So the next one that I got that I'm going to start in addition to this one is calcium plus magnesium, because Lyme just ruins everything, guys. It really does. So this is different forms of magnesium in it than what I've been taking here, so I'll probably do 2 of these and 2 of these a day. I was doing 4 of the glycinate, so I'll probably switch to 2 and 2. Also potassium. I get a ton of muscle cramps, and I've noticed that when I take potassium, I feel a lot better. It is very hard to overdose on potassium. It's very bad to overdose on it, but it's also very hard to. I mean, each of these pills only has 2% of the recommended daily limit, I guess you'd call it, for something that you shouldn't go over on. So I look at what I'm getting potassium in my diet, and it's really not much. I'm not taking in that much right now, so I do need to supplement it, and so far it's been helping a lot. I do have to take a lot of it. I try to hit between 40 and 60%, and that seems to be about right. And the other thing I'm taking all the time is vitamin D3. Chronic illness depletes your vitamin D as well. And a lot of okay, there's this sort of catch-22 that you get. A lot of doctors, if you have a chronic illness, will say, well, it's because you don't have enough magnesium, it's because you don't have enough vitamin D. Sorry about my voice, guys, it's driving me crazy too. And the problem is, deficiencies in these do not cause chronic illness. Chronic illness causes deficiencies in these. So if you supplement them and your levels are fine, and then your doctor finds out that you're supplementing them and they're surprised that you're not deficient, then they say, oh, well, you're taking too much, that's why you're tired, or whatever. But it's not that at all. But you get that all the time with doctors. You get that all the time when you tell them what you're taking. This is another magnesium supplement I sometimes take. It's another form of magnesium carbonate. And I tend to take this when I really know that I've overdone it and I really need an extra boost. I should probably take it consistently, but it's hard to work it into my routine. So sometimes I take that. Then I've got, so these are kind of my core supplement regime. Vitamins and supplements is these are the things that I consider most important for my general health, and they're the things that seem to help me the most when I do them. I'm also taking omega-3s, as this is basically fish oil and this other one is flax oil. I started taking these when I was trying to grow my hair, because your hair needs good fats in order to grow healthily. So I started taking those, and I just kind of kept taking them. I haven't noticed any problems with them, and I have noticed I do feel better a little bit when I take them, so those are also a permanent part of my routine. I take a little bit of vitamin E. I take 1 of these a day, and I don't always get to it, so it's really more like 2 or 3 of these a week. But I started taking this when I started having eye problems, and this is running long, so I'm going to cut it off and go to the part 2 next.